welcome everybody. Welcome to those of you from New Zealand and India and Canada. It's wonderful to see you all, see you all online. Today we're doing a 1-hour lecture, roughly, on an introduction to acupuncture and acupressure for pregnancy and labor. So this is brought to you by Maternal Infant Health Canada, who are based out of Canada and are working on reducing maternal and infant death globally and focusing right now in India. The lecture is not actually for acupuncturists specifically. It's more for researchers and other health practitioners who are interested in learning about obstetrical acupuncture. The lecture will include an exploration of the evidence base of acupuncture and acupressure, as well as research and safety. I do have to do our disclaimer because this is recorded, so sometimes other people see this. So our official disclaimer. I will just say, this course and handouts contain information about medical conditions and treatments. The information is not advice and should not be treated as such. So I'll just put that there for everybody to read. Perfect. Well, let's just start a bit about me. So my name is Dr. Emily Solomons. Full disclosure, I am not a researcher or an academic. I am a clinician. I'm a doctor of Chinese medicine. I got my acupuncture license in 2005 and have been practicing since then. I work out of AcuBalance Wellness Center, which is an integrative reproductive medicine clinic here in Vancouver, Canada. I am the president of the Obstetrical Acupuncture Association, as well as I co-created and teach the first obstetrical acupuncture course for midwives in Canada. I am obviously a member of Maternal Infant Health Canada, who brought you this series, a birth doula, and I provide on-site labor and postpartum care, both in the hospital and home. I've put here a bit of my past work as well, which includes work in Uganda and in Nepal. All right, so let's get right to it. So before we learn about acupuncture and get into all of the wonderful research, we should probably get to the very beginning of it. What is Chinese medicine? So Chinese medicine consists of over 2,000 years of documented case studies and medical commentary, with the oldest text being written over 2,200 years ago. The cases have helped direct and confirm medical theories that are the foundation of this medicine. It is comprised of acupuncture, herbal medicine, tuina, which is a manual massage, kind of manual therapy, qigong, which is an exercise, and diet therapy. The Chinese medicine diagnostic system is based on observation. Observation was key to understanding both the status of the person and then its relationship to its environment. So before a diagnosis can occur, we need to understand both the status of the person and the relationship between the body and its environment. So the status of the person, the observation would be on physical attributes, like are they robust or weak? Are they hot? Are they cold? Are they pale or flushed? Basic body functions, so sweat, bowel movements, urination, digestion, sleep, emotional state, tongue diagnosis, which is one of the forms we do, and pulse diagnosis. Then, once they have the status of the person, they look at the relationship between the body and its environment. So the weather and how that affected the body, lifestyle, diet, external stresses, emotional factors. And from there, we can create suggestions and treatments based on the patient's state and their relationship to the environment. An example, actually, of the type of observational case studies and commentary would be documenting what happened when a woman went into labor. So a woman who was perhaps pale and obviously malnourished, or a woman who had a fever, or a woman who had just undergone a major physical stress, or it experienced a physical or emotional trauma. So what would happen to that woman during the labor? What would happen to that woman postpartum? And what would happen to the fetus? So after documenting that, then they would document what happened to her labor progress when they did the following XYZ treatment. So when one gathers that much information over several millennia, one develops a pretty in-depth medical system. And I should note here that failures and missteps were also well documented as lessons for future doctors. So, a death of a patient wasn't pushed under the rug and they're only putting the cases that are working. There really is a whole library of cases that didn't work and why they didn't work so that we could learn from them. All right, so as we merge into the topic of acupuncture, we first have to cover the word qi. Now, qi is one of those words in Chinese medicine, or in Chinese, I should say, that doesn't have a direct translation into English and has thus been very misunderstood. So I feel like those of you in India watching this that know the term prana would probably have a better understanding than someone coming from the West where there's no comparable word. The reductionist definition is that qi is energy, or even ATP. But that's far too narrow of a description. Maybe a more broad definition is that it's life force or the force within a body that creates and maintains order. But again, it extends beyond that and is not just limited to human physiology. The character of qi also gives some insight into the meaning of the word. So the character is actually the combination of two characters. You have the bottom uncooked rice, and then you have vapor. So you've got on the side there the picture of the cooking pot with the rice cooking. So qi is that act of transformation, but qi is both material and immaterial. And it's important to understand what qi is because with acupuncture, it's the act of manipulating qi within the body. I keep on going too fast with my slides. So what is acupuncture? The character for acupuncture actually translates into acupuncture and Moxibustion. However, the broader definition includes more. So it includes acupuncture, which is the stimulation of an acupoint with a filiform needle, which is usually these days stainless surgical steel, one-time use, then discarded. Acupressure, which is manual pressure, manual stimulation of those acupoints. Moxibustion, which is a special heat therapy on those acupoints. Electroacupuncture, which is electrical stimulation, usually using the needles and then putting electrical stimulation on the needles. And then photopuncture or laser acupuncture, which is laser stimulation of the acupuncture points. So what is acupuncture then? So to go into the Chinese medicine description of how acupuncture works would probably involve more than the hour we have allotted for this lecture. But the essence is that you're manipulating the qi flowing through the channels of the body in order to elicit a specific effect. So acupuncture is the stimulation of points on the body with an intention of eliciting a certain effect. Now, the Western perspective, they're trying really hard to put into words what acupuncture is doing from a Western perspective, and that's a few things. So acupuncture creates a neural, vascular, immunological, and endocrine response. Pain is inhibited by creating an immune response, increasing endorphins, relaxing muscle, and normalizing blood flow. Hormones are affected by the action of the needle insertion that triggers prostaglandins. The prostaglandins stimulate chemicals in the nerve endings that send a message to the hypothalamus that control hormone activity. It's a bit of a long-winded, but those are some of the things that we're starting to understand more and more of what's happening when we put a needle into the body. And I have put a few sources down there for the Evidence-Based Acupuncture, which is an international organization, and they've got a lot of good information on their website. So I've mentioned a few times this acupoint, so I should probably describe a little bit more about what an acupoint is, like where are we actually putting these needles. So there are 400 points that have been documented, but there's actually far more than that, but 400 that are officially documented, with the majority of the points being located on meridians or channels. And you can see I've got an image there of one of the models that show the channels and some of the points. An acupuncture point itself is a critical junction in the body where lots of information is coming into and leaving, not to be confused with a nerve. So it's by stimulating these nodes, you're able to direct and redirect to the body's natural processes. So these points are connected by channels, which almost all either begin or end at the extremities. So this is why you can stimulate a point on the leg or on the hand even, and affect the contractility of the uterus, because that channel may start on the hand, but it actually goes and it can innervate different internal organs. So there's channels on the leg that actually go and innervate the uterus. And so we don't have to go with a needle into the uterus to affect contractility. We can actually do external points that are distal, and still have an effect on the function of the internal organs. So, history of acupuncture in pregnancy and labor. Acupuncture has been used in pregnancy and labor and has been documented back to well before 300 Common Era, but there's some big major cases that came out around 300 Common Era that we have documentation of. So it's been around a long time. They have been working on pregnant women through that and documenting the results. When used by an adequately trained acupuncturist, because not everybody is actually trained in pregnancy and childbirth, it is shown to be a very safe and effective way to produce healthy, to support the healthy physiologic processes of birth. So here I've listed common reasons for patients to come in for perinatal acupuncture. There are more reasons, but these are probably the most common ones. Back and pelvic pain, pre-birth or cervical ripening, induction, nausea and vomiting in pregnancy, hyperemesis gravidarum, anxiety and depression, headache, migraines, heartburn, threatened miscarriage, anemia, pregnancy rashes, gestational diabetes, edema, pain. I've listed, upper back, ribs, wrist, carpal tunnel, but really pain anywhere in the body. Irritable uterus or uterine pain, threatened premature labor, postnatal depression, C-section recovery, insufficient lactation, which is an amazing one. It works really quickly. I love that one. Recurring mastitis, that's another one I really love. Eczema, thrush, sinus pain, and then diarrhea and constipation. So it's not limited to these, but these are really kind of common reasons for someone to come in requesting treatment. And we're not usually, just so you know, we're not usually the primary. There's always a birth attendant or their doctor that's overseeing them, but in order to address these conditions, they've sought us out. Which gets us to the next slide, which is examples of integrative maternal care. So I can only speak to my experience and that of my colleagues as an example of how acupuncture can be incorporated into a labor care setting. And that is, from my experience, what happens is you have the primary birth attendant, so the obstetrician, the general practitioner, or the midwife. And then the acupuncturist acts as an adjunct therapy and supportive care. So when it comes to referrals, generally it's patient requested. So it's usually how it starts. The patient seeks out acupuncture for whatever reasons. They're dissatisfied with the options given to them. They're looking for a more natural approach. The options that were given to them didn't work, or there's nothing else that seems to be helpful. But as time has gone, we found that we do get more and more obstetrician and midwife referrals. And usually the way that works is that the physician or the midwife sees results, or they build relationships with an acupuncturist, and then they start to refer to that acupuncturist. So I've got a obstetrician that anytime someone has sciatic pain will automatically direct them to our clinic. Because he's seen it be really effective, and he doesn't have a lot of tools for that, so he just automatically will send it. And same thing goes with, we have a lot of midwives who will send. In British Columbia, we have a guideline called the 40 at 40, which is when a woman is 40 years old, and once she is at 40 weeks for her gestational age, she is advised that an induction should happen shortly. So a lot of midwives and some GPs will send their patients to us to ensure that we're doing some cervical ripening and preparing the cervix, that if they have to go into an induction, it can be a more efficient one, and hopefully not lead to a cascade of intervention. So the care model that we currently have in BC is predominantly private pay. There's a few cases, I know, in detox acupuncture for addictions that the government pays, but for the most part, it's all private practice, and people are paying out of pocket. However, I do have colleagues in England, New Zealand, and Israel who are paid by the hospital or the government, and this, in my opinion, is a far more ideal situation, because the treatments can be based then on the need of the patient rather than on the budget of the patient. But, I've got big dreams. Hopefully one day I'll be able to help change that. Location, so most of it's done at a clinic. So for anything that doesn't require bed rest or hospitalization, the patient usually comes to the clinic for their care and for their perinatal visits. Hospital access is another one. So myself and quite a few of my colleagues, we have the access to the hospital to be able to do treatments when a patient's requested it. As I mentioned, I have some colleagues who actually work right in the hospital, some in New York, I think some in England, I think it was London, in Australia, and in New Zealand. So we've got hospital access. We're not working in the hospital, but for those people who are not allowed to leave the hospital, we are able to go in and do treatments during the labor or shortly postpartum. And then there's home visits. And I love doing home visits, but it's not that practical. And home visits are really good for people who are, again, on partial or full bed rest or postpartum. It's wonderful because then they don't have to move when they should really be resting. No large equipment is needed, so along with being very cost-effective, there's a lot of flexibility with the setting of where you do the acupuncture. When I mentioned I'd been to Uganda, so I did a training in Uganda a few years in a row that where we're training nurses, doctors, midwives, traditional medicine practitioners, basic acupuncture. And the groups we trained there used the acupuncture as a way to preserve the more costly procedures and medications. Because they had such a limited supply, they really wanted to save and guard that for the cases that absolutely needed it. So they used the acupuncture as a way to kind of help offset that need. And so far they've really found that to be really beneficial. And we've continued to do more trainings there over the past decade and a half. All right, so diagnostic differences between Eastern and Western medicine. I am simplifying this immensely here, but generally Western medicine is a reductionist system, dividing the body into smaller and smaller parts, so each organ or the cellular level or genes, etc. Whereas Chinese medicine is a holistic system focusing on the interaction between multiple systems. So the interactions between the organ systems, the interactions between psycho-emotional or environmental factors, and the role of this interaction on not only the chief complaint, but the overall health of the person. So it's not looking at one thing, it's always having to step back and say, well, how is that working with everything else that's going on in the body? And an example would be, let's consider a stalled labor. In Western medicine, a common response would be to augment with oxytocin. In Chinese medicine, before being able to do anything, we would first need to ask, well, why is this labor stalled? Is it due to fatigue? Is it emotional stress? Is it physical stress? Is it poor positioning of the fetus or a physical block, etc.? You may have 4 different patients with stalled labor, and they would each get a completely different treatment. So the fatigue patient may get a treatment for therapeutic rest. The emotionally stressed patient may get a calming psycho-emotional points. The next patient may have a treatment for malposition of the fetus. And then the physical block would likely need more investigation on whether or not they could physically birth the baby. So addressing these factors in most cases initiates the labor. Without having to do an augment, the contractions would start going. Or if you did have to do an augment of some sort, you would need less because the root was being treated and not just the branch symptom. And it's also, because of this, less likely to lead to a cascade of intervention. So the same goes for the treatment of just general pain in labor. Acupuncture is not blocking pain. It is stimulating the body to work more effectively, which results in less pain. So it's just a slightly different way of looking at things, or maybe more than slightly different way of looking at things. All right. So I've touched a little bit on this. So this was a last-minute addition to my slides, so I don't have a ton. I've just put the links here for you, but these are 3 great papers that I've highlighted. Now, if both systems, Chinese and Western, work together while respecting where each excels, there is a potential for a more cost-effective approach to care, especially in the setting where there's limited pharmaceutical supplies and medical equipment. But even in hospitals in the West can benefit from cost savings and improved birth experiences for their patients. So the idea being that the use of preventative care and the treatment of less critical cases with acupuncture and other modalities, like for those of you in India, Ayurveda, it can potentially reduce, but not eliminate, the need for major interventions. So like I said, I've included here 3 different papers highlighting the cost savings of an integrative approach. The one I'd like to reference is actually the second link. So this one is, and I apologize for not having any slides on this, cost savings from reducing pain through the delivery of integrative medicine program to hospitalized patients. So this isn't a maternal acupuncture study, but it is still very relevant. And this was done in Minneapolis, United States. It included 2,730 adult inpatient admissions. The outcome measures were a change in pain on a 11-point numeric rating scale before and after the initial integrative medicine session. And then the other one was total cost of hospital admissions. So the results here were, for patients receiving integrative medicine therapies, pain was reduced by an average of 2.05 points, and this pain reduction was associated with cost savings of roughly $898 per hospital admission. So that's a decent amount of money. So yeah, that's a good one to look into. The third link is the one that I actually am going to be touching on at the end, or actually I'm going to be going into quite a bit of detail at the very end of this lecture. And it is the cost analysis for the complementary therapies for labor and birth study that, yes, I'll be referencing at the end of the lecture. I've included this study and the cost analysis posters to your downloadable lecture notes. So hopefully our tech Jazz has already added those. If not, I'll make sure that they're on so that you have them. The conclusion of this last study is that this is one for antenatal education programs. So why I like it so much is it's not necessarily treatment-based, it's more educational program-based, which is a lot easier to work in rural settings. So the antenatal education program led to a significant savings to payers that come from a reduced use of hospital resources. Depending on which perspective is considered and who is responsible for covering the cost of the program, the net savings varied from 659 Australian dollars to 808 Australian dollars per woman. Compared with the average cost of birth in the control group, they concluded that the program could lead to a reduction in birth-related healthcare costs of approximately 9%, which is, I mean, that excites me. That sounds really something we'd want to look further into. Now, as you'll see once I get to it at the end of the lecture, this was a very, very small study, like 176 people. So there's a lot more research that needs to be done. We need to do this on a larger scale, but I think it is definitely worth doing on a larger scale. All right. So before I actually get into the research, I really want to touch on some of the challenges and potential solutions that we can do. So one of the main challenges that we have with acupuncture research is differential diagnosis. So differential diagnosis is essential to proper diagnosis and a treatment plan. This is where protocol-based research faces many challenges. Many of the protocols don't reflect clinical practice. This one-size-fits-all is not Chinese medicine concept, so it often doesn't translate into good research. So having one single protocol, point protocol for a condition like labor pain or induction takes a Western approach to and just throws Eastern tools into it. And because it doesn't reflect the results and the way we work in clinical practice, it's not a great reflection and shouldn't really be a tool used. The next one is sham acupuncture. And a lot of studies use sham acupuncture, and I understand why there's obviously a desire to do that. However, sham acupuncture is actually not inert. If you're sham, there's a few different types of sham acupuncture. So one of them is where you would use the same acupuncture point, but only mild stimulation. So you're not having deep stimulation. But again, you're still stimulating the point. It's like comparing the same drug but at different doses. That's not a sham, that's comparing a drug at a high dose and a little dose. Another sham acupuncture that's used is where you would use different points on different parts of the body. Again, that's not inert because that's like doing a study on, say, acetaminophen for headaches and then using antibiotics as your sham. It's not inert, it's antibiotics. It has its own effect. So doing different points is still going to have an effect, whether positive or negative. So yeah, that's for sham acupuncture. I'm really not a fan of that. The last challenge that we face is frequency. So frequency is often not highlighted when considering the results of a study. Rather than assuming acupuncture does not work flat out because the study failed, it's important to look at the points used and the frequency of the treatment. Again, it's like taking acetaminophen once a day rather than every 4 hours, resulting in little effect or recurrence of the headache. It's not necessarily that the acetaminophen didn't work. It means that you just weren't taking it frequently enough. So a good example for this one, and I'm going to jump ahead here, is in Chinese medicine is the Moxibustion for breech. So I'm going to just skip one ahead and cover that. So Moxibustion for breech is one of the few one-point treatments that, so because of that, the fact to only use one treatment or one point, it's done for everybody. They've done a lot of studies on this. It requires heating a point on the toe with a Moxibustion stick at a certain time to help turn a baby or initiate a natural cephalic version, not a forced one or a medical one. So the breech treatments have very promising results when they are done twice a day for 20 minutes each toe, and when done between the weeks of 33 and 36 weeks gestational age. As I mentioned, because this is one of those few one-point treatments, the study is being done many times. However, the frequency and dosage variations, the inclusion of acupuncture along with the Moxibustion, which changes the treatment, a lack of consideration for both the gestational age and the parietal of the woman when reviewing the research has led to conflicting results, naturally, which lessens the confidence of someone to suggest using this cost-effective and safe treatment. And I've put here in the chart just some of the different studies that have been done, and you'll see there that the frequency changes from daily to twice a day, length and dosage of treatments, sometimes it's 10 minutes, 15, 20 minutes. Moxibustion is done alone, it's done with acupuncture. There's sometimes no reference to whether it is a primip or a multip, and the gestational age, they don't always reference that or focus on that. And realistically, this treatment after 36 weeks is far less effective. So these things need to really be considered when you're looking at this kind of research. Now I'm going to hop back. Because I've been so negative talking about all the challenges, I want to talk about some more promising things that are coming around. So some promising research is in comparative effectiveness research. So in this case, comparing acupuncture and standard care to standard care alone. The question being, do you save money? And do you have better outcomes when you do both together? The next one would be something called whole system acupuncture, which allows for a differential diagnosis and point selection to occur with each patient during each treatment. So it's really using where we excel, which is differentiation, really treating the patient individually. Let me just switch up that. There we go. Okay, so as we delve into research, I like to begin with safety. Safety is a great place to start. So the safety of acupuncture during pregnancy, a systematic review. When acupuncture was used during pregnancy, there was no evidence within the research of increased miscarriage rates, intrauterine death, or premature birth. So treatments in the review included, in early pregnancy was nausea and vomiting. Later in pregnancy was breech, pain, depression. Labor induction and pain relief during labor was the last one. And that included both acupuncture and acupressure. I feel this is very important to note that whether the studies showed that the acupuncture worked or not, they all noted that it was safe. So it's, yeah, and I have links at the bottom there, source the study if you want to learn. For all of the research, you do have it cited at the bottom. All right, so quality studies. As I mentioned, I am not a researcher, so hopefully you won't grill me too hard on that. However, I have gathered some key quality studies that I feel would be of interest for those of you who are researchers. All right, the first one is low back and pelvic pain during pregnancy. So this was acupuncture for the treatment of women with back and pelvic pain in pregnancy over usual care. And this was a systematic review. All right, so the objectives were to update the evidence assessing the effects of any intervention used to prevent and treat low back pain, pelvic pain, or both during pregnancy. There were 34 randomized controlled trials, 5,121 pregnant women, ages between 16 to 45 with a gestational age of between 12 weeks and 38 weeks. The author's conclusion was evidence from single studies suggests that acupuncture improves pregnancy-related pain. So it's pretty straightforward. It was a good, a really good place to start. So we have another Cochrane review here. Headaches and migraines. Now, I will say that this actually isn't a pregnancy-specific study or retrospective review. However, it's very, very transferable and can be used in pregnancy. So that's why I've included it here. So acupuncture for tension-type headaches. The objective here would be to investigate whether acupuncture is A, more effective than no prophylactic treatment or routine care only. B, more effective than sham placebo acupuncture, which we all know how I feel about sham. Or C, as effective as other interventions in reducing headache frequency in adults with episodic or chronic tension-type headaches. So there were 12 trials with 2,349 adults, published up to January 2016, but I did have a look the other day, and they have added a few even more recent studies to that review. But from what I have here, it finished January 2016. The author's conclusion was, acupuncture is effective and could be considered a treatment option for migraine prophylaxis and tension-type headaches, but further trials, particularly comparing acupuncture with other treatment options, are needed. The available evidence suggests that a course of acupuncture consisting of at least 6 treatment sessions can be a valuable option for people with frequent tension-type headaches. So I added this because this is what I'm talking about when we're talking about frequency. It specifies here, and why I love this one, and I added it, is because it said 6 treatment sessions. A lot of times, people may use the same points. It'll look like the same study, but they do 2 sessions or 3 sessions, and then the results aren't the same. So then it waters down whether or not this is an effective treatment. And we see this a lot because I also work with in vitro fertilization in my clinic, and there's a lot of studies on leading up to transfer day when they're transferring the embryos. Recently there was some research that came out that showed that it suddenly wasn't effective, so it caused a big fuss that maybe the acupuncture wasn't really helping. However, when you looked at the research, they did 2 treatments prior to the transfer day, when all of the research that showed good effect was actually a minimum of 8 to 10 treatments leading up to the transfer, and that showed better live birth rates, better implantation rates, better pregnancy rates. So again, frequency is something that when you are looking at the literature, you really want to see what points they're using, what their frequency was, to know whether or not it is, why the results might be different. So the next one is acupuncture or acupressure for relieving pain and labor. Acupuncture or acupressure for relieving pain and labor. The objective is to examine the effect of acupuncture and acupressure for pain management in labor. It reviewed 13 trials and 1,986 women. The conclusion is that acupuncture and acupressure may have a role with reducing pain, increasing satisfaction with pain management, and reducing the use of pharmacological management. So this is where those cost savings come from, and where a general satisfaction of their care is higher in patients. Oops. All right, so acupressure for labor research. This is what I'm really most interested in highlighting here, mainly because of its transferability to regions that don't have a large acupuncturist population. So this is going to be a big one for those of you in India, although you do have a lot of acupuncturists. Okay, so acupressure for labor. What is the benefit of using acupressure? The nice thing about acupressure is it can be done by anyone. So family members, friends, labor support staff, really anyone can be trained in acupressure. It can be done early, before the need for medical intervention, which is great. So there's lots of things you can do straight away if it looks like the birth's not going exactly as planned. or just as a supportive tool throughout the birth. It is very, very safe, which is nice, and it promotes partner involvement when taught to the birth partner, which for a lot of communities, that's really important to start involving the partner in supporting the birth. So let me get to some. So this is the study I referenced when we were talking about cost savings. Complementary therapies for labor and birth study. I feel like this one would be most relevant and applicable to the Indian setting, but this was done in Australia and can literally be done anywhere in the world. As I mentioned, it was a very small study, so 176 nulliparous women with low-risk pregnancies attending hospital-based antenatal clinics in Sydney, Australia. The complementary therapies for labor and birth protocol incorporated 6 evidence-based complementary medicine techniques. So it used acupuncture, or acupressure, I should say, visualization and relaxation, breathing and massage, breathing, massage, yoga techniques. This is where I thought it would be great for you in India, and facilitated partner support. So randomization occurred at 24 to 36 weeks gestation, and participants attended a 2-day antenatal education program plus standard care versus standard care alone. Main outcomes measured were rate of analgesic epidural use. Secondary was onset of labor, augmentation, mode of birth, and newborn outcomes. The results are that the study protocol significantly reduced epidural and cesarean section use. Epidurals were reduced by 65%, cesareans reduced by 44%. So this study provides evidence for integrative medicine as an effective adjunct to antenatal education and contributes to the body of best practice evidence. The study was small. But this is a study I would love to see reproduced on a larger scale and with different demographics. I've included in your handouts, which you should be able to download, the study poster for this. I can also connect you with the author of this the study because I've met her recently. I also included the economic analysis for this and the supplementary handouts that explains in detail each of the techniques, evidence-based techniques that were used. And then there's just like a little poster here that shows what it is. So if people are interested, I can definitely connect you with that author. Now, one of those 6 evidence-based methods was acupressure for labor, and the study took the acupressure course created by Deborah Betts, who is from New Zealand, and in that course she included the following protocols. So I put 2 posters here of kind of a simplified version of the protocols. The course can be taught to a group in as little as 30 minutes. Or on an individual basis, I add it to my antenatal visits. So maybe 10 minutes, 15 minutes, I get the birth partner to come in, I show them the points, I give them the booklet, they go home. At their next antenatal visit, if they have questions, they can ask, and then they can just practice. So it's very easy to be able to do in a lot of different settings. The protocols in this case are all straightforward, and the acupressure handouts and guides have already actually been translated into almost a dozen different languages. So this is very easy to be able to use throughout the world in a lot of different settings. And I will say, I think because I had mentioned with the Foundation for Medical Research, we had chatted, if there is an interest, I would be happy at a later date to provide training for this. But yes, that's definitely possible. Okay, so conclusion. So we wrap this up. So acupuncture and acupressure have the potential for being a very useful and cost-effective adjunct therapy for pregnancy and childbirth. More research is, as always, needed, but we need more research that does a better job at respecting Chinese medicine diagnostics and treatment principles. Yeah, so that's everything. So maybe what we'll do now is I will close this and see if anybody has, I'll open up the floor. If anybody has any questions, they are welcome to type them below on the left-hand side. And like I said, this is going to be recorded, so if you have colleagues or somebody else, or you want to look at it again, you're welcome to. The slides, as well as a bunch of extra reference material, should all be downloadable. I think there should be a link when you go to the Healthy Seminars page with our talk to be able to download all the notes. And I do want to say, actually, a very big thank you to Healthy Seminars who are offering their services free for the Maternal Infant Health Canada. So let's see if... oh, perfect. Okay, so I see Farah has raised her hand. So if you want, Farah, just at the bottom left-hand side, you're going to see a post your question or comment. If you write your question down there, then I'll just go one by one and answer them. I see a few people are typing, so I'll just wait a few minutes here and see if anything comes up. What would be the duration of the training course, and who all could take up this training, especially the acupuncture, and practice it? Okay, so there's two different trainings. When we're talking about, when I was referencing training, I was actually referencing the acupressure training. So the acupressure training can be done to anyone. So that could be in India, it could be like the ASHA workers, it could be the Ayush, it could be partners, it could be village elders, it could be, basically anyone. It could be done on an ongoing basis as just part of a clinic. For the acupuncture, in Uganda, where I'm working with the Global Acupuncture Project, and so there it was done a little bit differently. So that was kind of a protocol-based with differentiation booklet that was created, and the trainings are intensive one-week trainings over a period of a year. And that was over kind of the basics of acupuncture. So there would be an intensive training that would be done. Then they would go out into the field, do a bit of acupuncture, gather case studies. A couple months later, we would come back, do another training, see what issues came up, and kind of went from there. Then that would happen kind of 4 times throughout the year, and then at the end they were ready to go off and do their own. And currently what I'm creating is an advanced maternal acupuncture course that's going to be done there for anyone who's done the existing 1-year training course. However, this is not to the level of an acupuncturist. I mean, I went to school for 5 years, so the level is a lot more basic, but it does give some basic tools, and they have actually been getting really good results. They're in hospitals there, they're in rural clinics. We did treat some traditional healers because 80% of Ugandans still work with traditional practitioners rather than Western medicine. So we've worked on a lot of different groups, and yeah, it's been quite successful. So next one. Hi, I'm wondering if our Indian partners at FMR have an idea about how acupuncture and other TCM techniques could help pregnant and laboring women in India. Yeah, so if anyone from FMR wants to type in, that would be great. This would, oh, we have, there we go. Perfect. See if anybody from a couple Farah's typing. Okay, yes, we got FMR and Shilpa adding their 2 cents. All right. Yes, acupressure will be more useful than acupuncture. That was my thoughts. My thoughts was that acupressure is probably going to be the one, and that last study that I mentioned that involved the breathing, the acupressure, the yoga, all of these things. I mean, it looked like it would be really easily transferable to the Indian setting. So this is something I'd love to see, and I'd love to kind of work with FMR in the future and see if we can, and even get in the author of that study, perhaps to do something with your group. I think that would be really great. Relaxation, breathing, yoga. Oh, sorry, it's going a little fast. There are private hospitals who try these alternative techniques. Okay, yoga, relaxation, but not sure about acupuncture. Yeah. And then asking Nurgis and Tanaz if anyone doing acupressure or Chinese medicine in India for any conditions. Okay. Could you describe the different modules for different stages of pregnancy? I guess you'd have to maybe go into more details with that question. So we treat all, yeah, I don't think I fully understand what you mean by that. Yeah, so maybe those of you at FMR could elaborate on that question. Different stages of pregnancy. I generally see my patients from even preconception. When to have different modules. Like when it comes to the training for acupuncture, we don't necessarily do it in modules by trimester. The training for acupuncture is generally done, the modules are done kind of a basic in understanding how the acupuncture works, where are the points, how to needle correctly, the surface anatomy, then how to use, because we don't have the time to be able to do a full, so you can do all the diagnosis yourself, we basically have a module where you learn how to use the manual, so that has kind of the top chief complaints that come in, and then kind of how to work the diagnostic system within the manual to be able to come to your conclusion of your point protocol. So it's a little bit of a different way of doing things. It's not ideal. It's much easier and better to have an actual acupuncturist, but for those who don't in these smaller areas, it has been quite helpful. So yeah, so each time we do a module, but it's not done by trimester. And then the obstetrical medicine is generally done as an adjunct at the very end, once they've done the general training. Farah asked, do you think there would be an interest in having a training sessions for ASHA workers, A&Ms and others, Shilpa? Yeah, what I'm thinking as far as trainings, first would be to do an acupressure workshop, because that's just one, it would be a 1-hour lecture. I could do it online. I would have someone where I could demonstrate. You'd have the handouts that you could print out so that for each pregnant patient, they get the booklet with all of the points, or each ASHA worker would get the booklet with the points. I could do that training 1 hour and really feel confident that the people leaving would be able to then go and start using it and being able to teach it, continue to teach it to others. Yeah, and it would be, you know, very resonant with Ayush modalities. However, acupressure, I teach acupressure to absolutely everybody. I have surgeon patients and mathematicians and people who have, you know, very little experience in Chinese medicine, and their partner's pregnant, and I teach them how to do it, and they have no problem doing it. And because from that last research that I showed, it is so effective that I really don't think it has to even be pinholed into just one specific, you know, more Eastern-based group of people. I really think that Eastern medicine-based group of people, I really think you can do it for anybody who is working regularly with pregnant patients. So yeah, Shilpa says acupressure for the A&Ms, their supervisors, medical officers may be helpful. Yes, what I have found is that for the people who are, it wasn't very, in Uganda, we didn't find it very helpful to train the doctors. because the doctors were already so busy. They already had so much on their plate that it was actually best to do the people who, the nurses, the aides, the traditional healers, the other people who were birth workers who were there, who were spending a lot more time with the patient and who could be there and using their hands and pushing on points on the patient and weren't like running off to go deal with an emergency. Emily, C-section rates are skyrocketing in India. How do you think that TCM techniques would be helpful in keeping these rates down? Well, as you saw from that last research, I mean, I think, what was it, 65%? We can actually go back. 1, 2, oops. There we go. Epidural rates were reduced by 65% and cesarean rates by 44%. Now, this was a small study in a very specific group, but I really think if we are focusing in antenatal education programs and tools that you can do between, there being a concern with the birth and there being a C-section, there's a lot of space in between there where someone skilled would be able to see that it's, going a little bit sideways, and you'd be able to intervene with something as simple as acupressure. So I think the antenatal education and things like acupressure in labor are really great because there's something you can use before you use the big tools, right? So something before C-section. And even that idea, like the Chinese medicine idea of like, okay, well, why is it taking so long? Why is it stalled? Why are they having an inability to cope with the pain? Rather than, oh, they're having an inability to cope with the pain, let's get them into an epidural. Oh, now the labor stalled. Okay, now there's been a decel. Now we need to do a C-section. Fernandez Hospital may be open to doing acupressure. Okay, well, that's great. So yeah, maybe gather as much as you can for information and we will see what we can do in the future.